Health Services Committee to order. And the first order on the agenda is to approve last month's committee meetings. Would someone like to make that motion?
I'll make the motion, Edna. This is Peter.
Okay, thank you, Pete, for seconding that motion. John, would you do that, please, Mr. Stroud? Okay, thank you. Any corrections or additions? All right, all those in favor?
Aye.
Aye.
Opposed? Carried. Thank you. And with that, Rob, good morning. How are you?
Good morning. How are you, Chairwoman?
Thank you. I'll turn the meeting over to you now.
Very good. Thank you.
Mhm.
So I have two resolution requests to present this morning. First request is to amend the 2021 Warren County budget in the amount of $236,375 in additional state aid from the New York State Office of Mental Health. The rationale here is this is additional one-time funding, again, 100% state aid that is available to Warren County to support outpatient mental health services provided by the Behavioral Health Services North, which is the agency that took over services from Glens Falls Hospital.
All right, thank you. Would someone like to make that motion?
John Stroud, I'll make that motion.
Thank you, John. A second to that motion?
I'll second it. This is Peter.
Thank you, Mr. McDevitt. Any questions? All right, all those in favor?
Aye.
Aye.
Opposed? Carried. Thank you. Rob,
Okay,
number
second.
two. Mhm.
Yep. Second item then is request to for approval to enter into an intermunicipal agreement with Saratoga County detailing certain shared mental health services. Rationale is previous intermunicipal agreement regarding some shared mental health services, specifically home-based crisis intervention services and mobile crisis services that are provided by Parsons Child and Family Center, which is part of Northern Rivers, for children, youth, and families has expired. So it is desired and beneficial to both counties now to renew the agreement. And we also have an additional service that we would like to include in that is the ACT team services, assertive community treatment. So for the three services, we would like to have an intermunicipal agreement with Saratoga County. And again, these services are funded with 100% state aid.
Okay, very good. Would someone like to make a motion to pass that resolution?
John Stroud, I'll make that motion.
Thank you, John. A second to that?
I'll second it. This is Peter.
Thank you, Peter. Any discussion on that one? All right, if not, then we'll vote on it. All those in favor?
Aye.
Aye.
Opposed? Carried. Thank you. Under discussion items, we have none. We have no referrals or pending items. Mr. Lehman, do we have anything out in your direction?
Good morning. We have nothing on YouTube at this time.
Okay, thank you. Rob, do you have anything else?
Nothing else. Thank you.
Okay, thank you very much. We'll see you next month then.
Yep.
Okay, is Dee on board?
Yes,
Oh, okay, good. Then we're going to turn it right over to you, Dee. How are things going with you?
we're busy.
I know, that's what I've heard. I've heard you've been very busy, doing a great job over there, Bill. We appreciate that. All right, so I'll turn it over to you.
Okay, the first two items on our agenda are permission to fill two vacant positions that we actually requested back in July, I believe it was, July or August. And we had not been able to fill them, and the notice of intent to fills expired in January. So we're coming back to the board to the committee to request to fill those again. We do have individuals that we have selected for the positions. So it's just a matter of going to the committee and then the full board to get permission to fill them again. And those are our meal site manager, number 5, which is at the Warrensburg meal site, and our fiscal coordinator position here in the Office for the Aging.
All right, thank you. Would someone like to make a motion to approve those two?
I'll move it. This is Peter.
Thank you, Mr. McDevitt. A second to that?
I'll second it.
All right, thank you. Mr. Conover, any questions or concerns? All right, now we'll vote then. All those in favor?
Aye.
Aye.
Opposed? Thank you. Carried.
And then the last item on our agenda was permission to submit our 2020-2021 MIPA application in the amount of $22,259. This application is for the period of September 1st, 2020 through August 31st, 2021. We did not receive the actual grant application until January 19th, and it was due on February 19th. So it stands for the Medicare Improvements for Patients and Providers Act. It is 100% grant funding, so there is no county match required.
Okay, very good. Thank you. Would someone like to make the motion to approve that?
Yeah, John Stroud, I'll make the motion.
Thank you, Mr. Strauss. Second to that, Mr. Conover. Any discussion on that one? All right, if not, we'll vote on it then. All those in favor?
Aye.
Opposed? All right, thank you. Carried. All right, Dee, you're going to update us on this NYSOFA budget cuts?
Yes, so back in November, I notified you that the New York State Office for the Aging was told that the state was going to be imposing a 20% budget cut on all of our requests for reimbursement from them. Shortly after that, we did receive notification from the New York State Office for the Aging that they were going to make sure that we got our full reimbursement, so there was not going to be actually any cuts to our funding for the remainder of the 2020 budget year. So that was good news, so I just wanted to pass that along to everybody. And then last week, I believe it was, we were notified that we were actually going to get more stimulus funding for the 2021 budget year. We're not sure exactly what the amount will be, but I will share that with the chairman of the committee and the county administrator as soon as we are notified of that.
Great, thank you. That was good news then, huh?
Yes, very good news.
Okay, we have no pending items or referrals. Mr. Lehman, do we have anything on your end?
Morning, we still have no comment on YouTube.
All right, thank you. Dee, are we good then? Anything else you'd like to present us with?
Just one final thing that we were notified of late Friday. We have a discussion tomorrow with one of the pharmacies in the area. The Association on Aging set up this meeting, and we are hoping to get sole access to all of their vaccines for Warren County, so that we will be able to basically set up all of our Warren County residents with these vaccine doses each week, week after week. Again, that meeting is going to be held tomorrow, but that is very good news. So, you know, that's a positive. We'll be able to start making some appointments for our Warren County residents, just like we have been for our Hamilton County people. So we are anxiously looking forward to that meeting tomorrow. It will make us a lot more busier in the office, but I've got a couple of volunteers set up through family and friends to help us out with those. So, but that's good news, and we will keep you updated on that as well.
Oh, that's great. I know we're all happy to hear that. That's for sure. We appreciate you giving us that good information. I'm glad you got the volunteers to help you out. Okay, thank you, Dee. We'll talk to you next month then.
All right, thank you.
You're welcome. Alrighty. Is Janelle there? I can't tell. Yes, she is. I'm looking. Okay, Janelle, how are you today?
I'm good, thank you. Good morning, everybody.
Good morning. So I'm going to turn it right over to you.
All right, thank you.
Mhm.
So I have two resolution requests for today. The first one is to authorize an affiliation agreement in terms of 1 year as needed between Warren County Health Services and High Peaks Hospice and Palliative Care, Inc. to provide hospice care to patients referred by Warren County. This is attachment 1. We started this discussion at our last meeting. Agreement is in place in the event patients' needs are exceeding the skilled nursing services provided by our Certified Home Health Agency, or CHA, and the patients can be best served through hospice. There's no cost to the county for this agreement.
All right, thank you. Would someone like to make that motion to approve that? Supervisor?
I'll move it. This is Peter.
All right, thank you, Peter. A second to that by Supervisor Hogan. Any discussion on that? All right, if not, then we'll vote on that. All those in favor?
Aye.
Aye.
Opposed? All right, carried. Thank you.
All right, for the second, I'm going to turn it over to Ton because it's to request to transfer funds in the 2021 budget.
Okay, attachment number 2. I have 3 transfers for this year so far. The first one is transferring, at this point, $20,000 I'm going to take out of our part-time disease program to put into our overtime line in the disease program. This is primarily to cover all of the, I guess I'm going to say overtime that's related right now. It's all related to the COVID clinics, which started the beginning of January. And there's nothing in the overtime budget line, and we've had to utilize staff to do that. So at this point, I'm moving $20,000, and benefits and everything are still within that program, so I don't need to do anything there. My second one is we have a nurse that is in our MCH program budgeted. Again, that nurse is being utilized by the COVID activities. We're not really doing any maternal child health, family health. So again, I'm moving the salaries from that program over to disease program again, and some benefits to cover that position. And my third one is a similar one. It's a nurse that's been budgeted part-time within our home care, but she's being utilized again by COVID activities and doing contact tracing, and also she's also helping out at COVID clinics. So again, she's a part-time. I'm moving those salaries and just some benefits over again to the disease program, or yes, to the disease program to help cover those activities too. So the 3 of them are all related to COVID and the immunization in the clinic.
All right, thank you for that explanation. All right, would someone like to make that motion to approve that request? Mr. Conover, seconded by Supervisor Hogan. Any discussion on that?
I do, Madam Chairwoman. I just have one question.
Yes, go ahead, Mr. Conover.
Thank you, Tanya. The transfers, do you anticipate that this is going to create an issue down the road from where we're transferring from? Or do you feel good about the transfers in terms of the budget?
I think it will for now. It will depend on what's going on with COVID. Like I said, we have nothing budgeted at all in overtime salaries. When we did the budget, we didn't know how much of this impact would be. We are hoping that we will get some kind of funds. We have not gotten any grants yet to help with the COVID immunizations that we're doing. Of course, we've done clinics since the beginning of January, but I'm hoping if we get some funds for that, of course, I can bring that into the budget. But right now, this is just a cover. I'm hoping for the first quarter or into April. It depends on how busy we get.
Thank you.
All right, any other questions? Supervisor Hogan.
Thank you, Madam Chairwoman. This might be more of a question for Janelle instead of Ton. The moving of the home care nurse, how has that impacted home care in the county?
Well, it's a per diem staff member that we've moved over, so we haven't seen a big hit with that. And then just to further clarify, like from the maternal child health program, we do have a per diem nurse that's kind of assisting with the cases that really need to be seen, but we're kind of triaging them. But from a programmatic standpoint, if, you know, we're not really focusing on the maternal child health program from, you know, let's say January to June, those monies are just offset and being paid out of the program where the effort is being provided. I don't think we're going to have to go back and find how to pay for maternal child health program from January to June.
Thank you.
Does that make sense?
Sure. Yeah, thanks.
Any other questions? All right, then we'll vote on that. All those in favor?
Aye.
Opposed? Carried. Thank you.
All right, I think we're on to our information for discussion and review, so I'll let Ton do our attachment 3 and 4 for her typical reports.
Okay, that's fine.
Okay, attachment 3 were our financials as of February 11th. It is reflecting our 2021 year-to-date, which, of course, at this point really doesn't show a lot. It does show some expenses. Revenues still, we just closed our home care the end of last week, so that's not reflected here. But those revenues will be reflected in the next. And also year-to-date in 2020, we still have not closed, just to bring to your attention, obviously, 2020, so those numbers will be increased too. One thing we're still working on with 2020 is we have to get numbers from the WIC program for the value of the food vouchers. And again, I stated last month, that's just an expense and a revenue impact, so they offset each other, but it will be reflected in revenues. We did get approval February, I think it was 2nd from the state, that we could finally bill for our preschool program for last year, so that's been billed, and that was over $800,000, close to $900,000. That's already reflected in there. For this year, down below regarding the salaries, again, obviously a lot of it is COVID related. I did want to just note that I said part-time salaries in my notes below. 38,171 was part-time. That's really the total of all COVID salaries according to the grant lines that we're using for both overtime and part-time. Overtime, total COVID related salaries that don't include what we've done with the disease program for the clinic is $18,292, and that's 53.22% of total overtime. So more than half of our overtime is related to the COVID activities. And under part-time, $19,879 is related to part-time. That's just COVID-related activities again, and that's 37.08% of the total part-time salary that you see reflected. The next page, which is attachment 3, or attachment 4. Again, not much really to compare to from this year to last year. You'll see it's fairly comparable. The salaries already tough. We just had to buy some additional phone equipment for this year, so that's not a lot, $391. Contractual, again, we haven't really got all of our expenses. They're just starting to, we just got like January bills, so those aren't reflected. So it's just a timing issue, but it is comparable to last year when you look at the timing in the beginning of the year. And again, you can see the revenues, and I did note that there was for this time last year, a negative 21,000 in revenues for last year, but that was, it looked like it was some kind of an adjustment they had to do in the treasurer's office regarding some revenues for our preschool program. So that's where we stand right now. Not much to really show for 2021 right now.
Thank you, Tom. Do any committee members have any questions for Tom? No?
Great. So the next attachment is 5A and 5B. It just reflects the referrals. The good news is from December of 2019 to December of 2020, we actually had 50 more visits, which is good. Visits are remaining steady throughout the COVID pandemic, which, you know, I think our home care nurses are still taking care of patients in their homes, and, you know, we've had a lot of changes in addition to some reimbursement scenarios, which we're geared up and working on. Right now, I do know that census is a little low at the hospital, so we might see a little dip with regard to referrals, but for now, I think we're doing the status quo, and I don't have any concerns. Ton, do you have anything to add to that?
No, I believe that's exactly what I heard too. Their numbers were like in the 90s last week over at the hospital. And of course, I don't believe they've done yet the elective surgeries. I think are still out there.
Janelle, Madam Chairwoman?
Yes.
Yes, Mr.
I have a
Connell.
question
Go ahead.
for Janelle. Thank you. Janelle, how are the vaccinations being handled, if at all, through the CHOS? Are we, especially for the homebound, I'm concerned. Do we need our doses to increase to delivery for the homebound? How exactly is that being handled?
Well, I have an update in a few minutes, but I certainly
We can wait
love
for
to
that.
see our.
We can wait.
I certainly would love to see our vaccine increase. With regard to home, we're working with our local partners, and certainly our home care nurses can give shots to those that are in the home. We have to kind of coordinate those because of the timing of when you flip open the vial and, you know, how long you have to use the vaccine and things like that. But those are nothing that we can't work around. But we do intend on helping with our home care nurses, our public health nurses, and our EMTs to help deliver within the homes. In addition to some primary care providers also have home programs where they're able to offer them in the homes as well. The big issue right now, as you pointed out, is vaccine supply. So we're kind of waiting on that.
Thank you.
The next attachment is attachment 6. That's our emergency preparedness activity sheet. We reflect as much as we can remember, but truly all of our time and effort right now should be on the sheet. But it just gives you kind of an idea of what we do and what some of the clinics we've done and things like that. And if people have questions, you know, I'm more than happy to entertain that. With our rabies program, in the midst of COVID, we're still getting animal bite reports and rabies prophylaxis needs and things like that. So we're kind of giving you our stats for that. We don't have any clinics planned at this moment, but we're hoping to plan some clinics in the spring and try to coordinate them around our COVID clinics. But for right now, I mean, we did have 4 clinics towards the end of last year. Also, for the good of the group, we have some meeting requests. Spring is a busy time for conferences and things like that. Our WIC program always has a lot in the spring. All these are grant funded for the most part. The other thing is, in non-COVID years, a lot of these meetings are in-person meetings, so the cost was thought to be more because we had budgeted for hotel expenses, meal expenses, things like that. So the money is in the budget, it's in the grant, but because of the virtual scenario, we were able to have more staff participate. So the first one is the New York State WIC Association Conference, which is virtual in March. It's March 16th through 18th. And we've invited all 7 of our WIC staff to participate. It's $150 per person, which equals out to $1,050. And like I said, we had initially set aside $2,000 for 2 people to attend. So we were able to get way more bang for our buck there. In addition, we've requested that New York State WIC Breastfeeding Coalition Conference for March 23rd. We have 2 staff that will be attending that. Initially, we had budgeted $200. We're saving $10, and we're able to have 2 people participate in that. And then we have our WIC Gold Lactation Conference, and that's March through June. And we have a couple people participating in that at $225 per person. That's a total of $450. Again, all that is grant funded and within the grant program. And it's actually strongly encouraged that our WIC staff participate through the New York State WIC program.
Okay, sounds good.
And that's all I have for that.
And now you're going to give us an update.
Yes.
Okay, great.
So I'm going to do things a little differently today. I hope you don't mind. I know that Ryan sends a daily update to you with our stats as to how many cases we have and, you know, all that good stuff. I thought this time, because inquiring minds probably want to know, vaccine is probably more on the forefront of everybody's minds, and that's probably what you're getting most of your phone calls on. With regard, and maybe for the benefit of the people that might be watching from home, we have over 64,000 residents in Warren County. 13,900 of those, about 22% of those are seniors. So we do have a lot of seniors. Just to kind of put things in perspective, on a weekly basis, we've been receiving an average of 100 doses a week. So that does not go far, as you can imagine. And we're trying very hard to stretch that the best we can. The current lane that we're in, and we're part of the COVID-19 New York State vaccination program, and we had to sign an attestation as a provider. And that attestation basically said we'd vaccinate who we're told to vaccinate, and that can change at any time as participants of the New York State COVID vaccination program. So for those 100 doses that we typically receive, right now we are basically directed to do the 1B essential workers on that list. Unfortunately, that doesn't include seniors. That doesn't include healthcare workers. I've actually had to send a few of our home care nurses to the hospital who is able to vaccinate healthcare providers, as funny as that seems. So we're all trying our best to kind of work within the confines. We're working very closely with our partners. Vaccination continues to prove very challenging, especially for our senior population. And not only are they frustrated, I'm frustrated. I think our partners are frustrated. We historically have worked very well with our seniors. Public health has the ability to assist our seniors. We have the relationships with the senior centers. We know where the homebound seniors are. And we certainly have the will and the effort to be able to do this. We just don't have the vaccine, and right now we're not the provider that's issuing the vaccine to the seniors. But with that said, it doesn't mean that we don't care and that we don't want to be a part of our seniors vaccination program. We've worked very hard with our local partners, the hospital, the federally qualified health centers. We've worked with Office of the Aging and other departments. I can't say enough about Dee Park. Early on, for the seniors that didn't have internet access, she stepped up to help us with a waiting list. We've worked with the pharmacies. By worked with the pharmacies, we've reached out to the pharmacies to try to streamline that process of registration for the elderly people and to try to simplify it and make it easier. Unfortunately, you're dealing with some chains which maybe the local people don't know or have all the knowledge. It's more the, parent company that's making those decisions, and the chain might not know locally when they're getting vaccine or how many they're getting. We're also working with, smaller pharmacies as well. So it's not a one-size-fits-all. So it's hard to just say, everybody give me your links and this is what we're going to do, because some of that's out of the hands of the local pharmacies. I have reached out to all the pharmacies. I have told them if there's people or seniors that are unable to come in to get vaccinated, that, I would be more than willing as a public health agency to work with them to try to get our seniors in the home served. So they are aware of that. I haven't had any requests to date from that side. I have had a lot of community members that have reached out to me, and I've been working with Dee to get them on Dee's waiting list. When I do find out that there's pharmacies that are receiving vaccine, I've been working very closely with Office of the Aging to say, here's the vaccine that I'm understanding is coming to our community. Dee is able to and her staff are able to reach out to those pharmacies and help the people on her waiting list. Last I heard, she had well over 500 or 600 people on her waiting list. Last week was a successful week. We were able to get 20 people helped off that list. It's very slow, but again, I'm getting like 100 doses a week, and the few pharmacies in our community are getting 100 doses a week. So those doses aren't, sufficient enough to be able to do 13,900 people in a very quick fashion. We're also working with healthcare providers as well to help our seniors. So where it looks frustrating on the outside, I can assure you that we're working very, very hard to try to get our seniors taken care of. We're advocating through our Capital Region call. A lot of the regional counties are also advocating for the seniors and how to best try to serve that population, work with the pharmacies, et cetera. I did send a letter to the governor's office through the health commissioner in early February, basically advising of the frustration at the local level, the difficulty that the seniors are having monitoring all these websites and how frustrating that is to sign up for appointments, how unfortunately a lot of seniors are driving far, far away to get vaccinated at other state sites. And I offered some suggestions. I requested better communication, a streamlined process to fairly distribute the vaccine. I requested an allocation for us to, be able to kind of catch up our seniors, if you will. I requested that the pharmacy associations and pharmacies kind of be made to work with the local health departments and Office of the Aging to get timely information out to our seniors. And I also looked at the homebound seniors with the mobility issues, not being able to get to pharmacies or providers' offices, and we're working closely with them as well. So I just kind of wanted to give you a small update. I'm happy to entertain questions with regard to vaccine. Again, jumping quickly into the comorbidities. There's a lot of people that have comorbidities. Obviously, a lot of our senior population have comorbidities. We've seen a lot of deaths in our senior population. So right now, we're focusing on the elderly with the comorbidities, trying to triage them with what limited doses we have through providers. And then as more vaccine opens up, we're willing to kind of help other populations as well, focusing on the comorbidities.
Well, Janelle, we certainly appreciate that. And we appreciate everything that your department is doing. I think we have a couple of questions. Brad, I saw your hand. Go ahead.
Thank you, Chairman. Janelle, thank you. That was really a great report you gave. And my question is, I have a mother, my sister keeps pushing me to, who's 90, about the shots and that, and I keep updating the information. And unless you sit there on a computer, constantly when you see it available, it's like a gamble shot of hitting the button at the same time that there's the availability. But my question is, I always see that it's open up in Plattsburgh and up in other northern,
Potsdam.
Yeah, Potsdam. Thank you. Are they getting too much? I mean, why is there's always availability up there and we're only getting 100 shots, 100 doses a week? I mean, that's not, that's embarrassing.
Well, I think what they're trying to do is allocate the vaccine based on population. I can't speak to the state sites directly because, I don't have control over who's getting vaccine where. I do know that the state is interested in having a vaccine site here as soon as they're able to kind of put aside a sustainable supply to keep our clinic open. I'm sure they'll be notifying us that they'll be opening our site. I hear the frustration. I understand that, but it's the state that's distributing to state, sites. One other thing that I've heard too is sometimes when there's a state site, that county receives a little less vaccine, knowing that a lot of their people are going to that site. We had a call with the governor's office last week, basically with the governor asking, thinking that the bigger sites are the better way to serve the population because you can push people in faster and get more people vaccinated. The counties are still kind of in the process of talking through our NICEHO organization because we're being asked to say, do we want our allocations to go to these state sites or do we want to continue to run our own clinics? I've said from the date strongly that our counties have the ability to do these clinics. We've practiced and scaled this up for the last 20 years. We have tons of volunteers that have reached out, and we're appreciating every single person that's reached out and ready to go. The issue is until we have the vaccine, we can't have a bunch of people standing around a clinic to give 100 doses. So right now our staff have been able to do that, and we're starting to pull in the volunteers. We actually have nursing students that are going to be volunteering with us to try to get some clinical hours through SUNY Adirondack. And that will cut down on our overtime.
Well, that's great, and thank you. My next question is, if by chance, because it looks like we're all set up and ready to rock and roll across the street up here, would that be a combined effort with the county and the state to run, or is the state just going to come up and run that?
My understanding is it is a state site, but our county will be collaborating and providing support as needed and requested.
So I guess my question is not that we'd get, imagine they would stay on the same scheduling where you'd have to sit there on your computer 24/7 until you can get an appointment at this particular site. I'm sure it's the same way up in Potsdam and in Plattsburgh.
That site registration will work very similar. It'll be posted on the Am I Eligible State website.
All right, thank you, and thank you for all you're doing.
All right, any other committee members have questions?
Yes,
Mr. Stroud?
thank you.
Mhm.
Again, Janelle, thanks for all you're doing. We deeply appreciate it. But, and I'll report this to the state too, but I'm just relaying it to you. I'm sure you've heard it. That elderly couples who are eligible, those who are over 65, as a matter of fact, I got a call yesterday about one, is that they will go online and they always are frustrated to make their appointment. So they'll get one of their spouse team, confirmed for an appointment. And this one yesterday was in Potsdam, 3-hour drive each way. But by the time they went on to get their spouse also registered, it was days apart. So she called me yesterday and she says, I have to drive to Potsdam 4 times, once for me and once for my husband. And I said, there should be a better way if you are spousal relationships of getting it done in one day. There must be some arrangement on that website or something. So I will share that with the governor's office. But if you have a chance, that's one of the snags in the system, is that if you're making an appointment for yourself and your spouse, that they allow you time to do both so you can both show up at the same day. All right. Well, so I decided to share that with you because I've heard it multiple times. All right. Thank you.
Thank you, John. Any other?
I'll continue to move that up my chain as well, through the hub that we have. We do have state representation on that hub that I participate in the daily calls with. So I'll definitely, see where we're at with that status, but it makes total sense.
Yeah. Thank you.
Absolutely. Any other supervisors who have a question? No? Not. We'll see if Mr. Lehman has anything for us.
Hello, we have nothing on YouTube as of now.
Okay, thank you, Don. All right, thank you very much, Janelle. You people down there do a wonderful job, and just know that you are definitely appreciated. The hours that you put in are unbelievable. So thank you. All right, with that, I will entertain a motion to adjourn. Supervisor Conover, seconded by Supervisor Hogan. All those in favor?
Aye.
Okay, thank you. Have a good afternoon.
Hey, Janelle. Oh, did I lose her?